Hello and welcome Health First Health Plan members. I want to thank you for being proactive about your bladder health. I would like to share with you a recent event that I did on urinary incontinence and how you can take control of your bladder. Viewers of this event were able to ask questions, so I encourage you to watch the entire event to see if your questions are answered. Thank you.
Hi, my name is Carrie Andreu. I am a urogynecologist here at Health First. I have offices here in Vieira, where we're at right now, and then also at Gateway. I want to thank everybody for joining in for our talk tonight. It's pretty informal, and what we're going to try to cover, the topic being breaking up with the bathroom. So we're going to just have more of a conversation. I'm going to go over some of the more common types of urinary issues, urine leakage, go over briefly what causes them, and then some things that we do to treat them. This is just to kind of keep me on track, and then also to give you an idea. You know, we follow a pathway that kind of helps us in the management of all of these conditions. So I'll start by just saying that urinary incontinence in general is very common. You know, it's all I do, and I have you know, 2 other people here that do full-time urogynecology as well. So all we do is urinary incontinence and prolapse. So that's how many people deal with this on a daily basis. I'll give you a little bit of my background. I did a 4-year residency in OBGYN. I did that at the University of Cincinnati. I then did a 3-year fellowship in just urogynecology. So that specializes in just prolapse, so pelvic organ prolapse, and urinary incontinence. So if it's leaking or if it's falling out, then we can fix it. And then worked in Arkansas for about 5 years there in a private practice setting, and then came here. Dr. Tu, the other urogynecologist here at this office in Vieira, and I trained together, so I came to join her. And I've been here coming up on 2 years. So to start with, we'll just kind of go over the 2, I guess, main types of leakage. And usually I talk a lot with my hands, and I usually have a lot of pictures and props, so I'll just try to kind of be descriptive. But there's 2 main types. There's what we call stress incontinence, and then there's what we call overactive bladder. So I'll start with stress incontinence. Stress incontinence is a muscle problem. So essentially what that means is that when you put physical stress, not emotional, but physical stress on the bladder, so you cough, you sneeze, you exercise, you pick something up, anything that puts pressure on that lower abdomen, what should happen is that the muscles in the vaginal area should be able to clamp down around that bladder so that it doesn't matter if you're jumping on a trampoline with a full bladder, nothing's coming out. So age, wear and tear, all of those things can, you know, wreak havoc on those muscles. So, you know, I see women of all ages. So there are some 20 and 30-year-olds that, you know, after pregnancy and childbirth, you know, especially if they've had twins or a particularly traumatic vaginal delivery, they can have some issues with stress incontinence. And then menopause is another big culprit. So, you know, the loss of estrogen can cause a real decrease in the muscle mass in the vaginal area, among other things. And so that's another time where stress incontinence in particular becomes an issue. So that's what stress incontinence is, or some of the symptoms that are associated with it. So then how do we fix it? So I'll move through the treatments, kind of going from most conservative to most interventional. So to start with, stress incontinence is a muscle problem. So there are, as strange as it may seem, several really good pelvic floor physical therapists in the Melbourne area that only treat pelvic problems. So that includes stress incontinence. And a lot of people think, well, I already do my Kegels and it didn't work. But it's kind of like going to the gym and you walk the track a couple of times versus having Serena Williams trainer. So there's going to be a difference. And I know from my office and when I see people here, a lot of people when they're doing Kegels, they're doing really good butt and thigh exercises, but you're not really isolating those muscles that are involved in making sure that you don't leak. So you don't necessarily have to go, every week or twice a week, kind of like when you're rehabbing a shoulder or a knee, but it is really helpful, especially for younger women who may want to have more kids or aren't ready to jump right into surgery. You can really go and get a lot of improvement by doing the correct exercises on a regular basis. So it's not overnight, but there's really no downside to building up that pelvic floor and building up those muscles. So that's the first thing that is out there and that we'd recommend. After that, depending on again how aggressive you want to be, there are what they call incontinence tampons that are marketed and available, obviously over the counter. So the most common one is by a company called Poise. They're the same ones that make the pads. And they have actual tampons that you can use that will put pressure again on that urethra and bladder to try to prevent leakage. This is helpful, I think, for women who, again, maybe they have more mild leakage, but it bothers them. So, when you're trying to, especially after you've had a baby, you're trying to get back in shape, lose some of that baby weight, and you want to start an exercise program, but every time you go try an exercise program, you leak. So those are really good because you can take them in and out and they can work, in specific areas. So when you're trying to exercise, you'd put one in, stop the leakage, and then, but it's not something you necessarily have to wear all the time. On the other end, there's something that's called an Incontinence Pessary. And that is a disc that has, it's hard, if I don't have pictures, but it's a disc and it has a little knob on there. And it inserts into the vaginal area again, and it puts pressure on that bladder and urethra. And typically, I can teach people how to take it in and out themselves, or you can just leave that in place, and then every 3 months you'd come into the office, we take it out, clean the vaginal area and put it back in. And in between, you just forget about it, because if we can find a incontinence pessary that fits correctly, then you shouldn't know it's there. So it's not something that's uncomfortable. It's just fit in the office. You come in, you have it done, you go home. So those are also non-surgical or non-procedural options to treat stress incontinence. Then we move down to there's surgery and then there's procedures. So the in-office procedure is something that's called urethral bulking. And urethral bulking is essentially like getting fillers that you get in your face, but you're going to get them in the urethra. So if you get fillers in your face, they're going to use like a silicone gel, and it kind of plumps up that tissue and pulls water in, and it just makes everything just a little bit bigger. So the same goes actually in the urethra. So if you remember, stress incontinence is when you put physical stress on the bladder. The muscles in the vagina are not able to clamp down so that, that pipe is partially open. So now when you put pressure on that, then water can leak through that pipe. So then what we try to do with the urethral bulking is to go in the office, with a camera and we go into the urethra, that tube that's too open, and we're caulking that pipe. So we use that filler and we fill in that pipe to kind of close the lumen. So now that pipe isn't so wide open. So, you know, it's not so wide open, so less urine, hopefully no urine, can leak out with activity. The benefit of that is that it's an office procedure. So there's